Hi, I'm Matt Ward, Head of Clinical Practice at West Midlands Ambulance Service. When cardiac arrest occurs, the heart stops beating effectively. Whilst the heart isn't beating, toxins build up in the body, especially in the brain, leading to brain death. You have approximately 8 to 10 minutes before this brain death becomes irreversible. Just under 7% of patients last year survived an out-of-hospital cardiac arrest. By providing resuscitation from the moment cardiac arrest occurs, we can significantly improve this, but we can only do this together with you. Approximately a quarter of cardiac arrests arrived at hospital last year with a pulse. However, many of these patients didn't survive because resuscitation wasn't commenced early enough. A sudden cardiac arrest can occur at any time for a patient of any age. It's very important that you check immediately that they're breathing. If they're not breathing, call 999. Don't be scared to start chest compressions. Sometimes we're asked, surely I could hurt the patient more. Well, in cardiac arrest, the patient has only one other option than resuscitation, and that is that they'll die. By you undertaking chest compressions and following the instructions you're given, you're significantly improving that patient's chances of survival. First, check for dangers. Make sure that you're safe, the scene's safe, and the casualty's safe. Next, you need to check for a response. Hello, can you hear me? If there is no response, you need to check for breathing. Open the airway by tilting the head all the way back. Then place your head near to the victim's mouth and look at the chest. You're looking, listening and feeling for breathing for 10 seconds. If there's no breathing, or if the breathing is slow or very irregular, then you need to start CPR. Identify the centre of the chest and place one hand and then the other hand on top. Lean over the casualty and compress the chest 5 to 6 centimetres at a rate of 100 to 120 per minute. After 2 minutes, evidence has shown that we become tired and that resuscitation is less effective. So call for help early. Pete, can you help?
Yeah,
can you bring the AED?
Got it. Shall I take over?
Yep, if you can take over in 5, 4, 3, 2, 1. When the ambulance crew arrives on scene, don't stop doing resuscitation. Continue doing chest compressions until they tell you they're ready to take over. An ambulance crew has a lot of equipment to place on the patient to start off with, including the defibrillator and organising breathing equipment. Following treatment by an ambulance crew for cardiac arrest, patients can go to a number of different centres. This will depend on the cause of the cardiac arrest. In cases of trauma, patients may go to a major trauma centre. If the cause is a heart attack, then they'll go to one of the 8 heart attack centres we have in the West Midlands region. Learning CPR can make a huge difference to the response that's provided if you encounter a cardiac arrest. There are many courses provided by Heart Start and also voluntary aid societies, and I would encourage you to attend these. Our main message is, following a cardiac arrest, if you don't give resuscitation a try, the patient will die.